Welcome to the Boehringer Academy Parasite webinar series. Today's webinar is called Control Considerations, and we'll be looking at the factors to consider when discussing parasite control for a particular pet. There are two main areas to discuss when talking about parasite control with a client. What parasite cover does the pet need, and what is the owner looking for? So we'll start by looking at what parasite cover does the pet need. To do this, each pet will need an individual parasite risk assessment. There are well-established risk factors for each parasite which will help you with this assessment, and so we'll go through these for each parasite now. We'll start with fleas, but there's actually not too much to consider with this parasite in terms of recommendations, because all cats and dogs are at risk of becoming infested with fleas. And so experts recommend that cats and dogs need continuous flea cover all year round. For ticks, there are a number of risk factors to consider when deciding whether a pet needs tick control. Firstly, it's important to understand their pet's lifestyle and their environmental habitat, and as this may indicate whether they have access to areas where ticks are commonly found. So you could ask questions like, does the pet have access to land where ruminants or deer graze? Or does the pet go on land where there is long, tall grass, or there's lots of bracken or undergrowth? And if you answer yes to either of these questions, then that pet should be considered at higher risk of being exposed to ticks. It's important to remember, however, that ticks can be found anywhere outside, and so any pet with outdoor access should still be considered at risk of being exposed. And while we're talking about environmental habitat, if a dog lives in Essex or is visiting Essex or the adjoining counties, then they should currently be assumed to be at risk of exposure to the tick-borne disease babesiosis, given the recent cases here. We then need to consider whether the pet has had ticks before, because if they have, it suggests their lifestyle may expose them to ticks again in the future. And lastly, pets that travel abroad may be exposed to exotic ticks or tick-borne diseases, and so they should be considered to be at high risk of tick exposure. And it's important to note that ticks are less of an issue for cats than dogs. Cats do still suffer from tick bite irritation, but tick-borne diseases are less of a concern. And also their grooming behaviour means that tick numbers are often reduced. So if a pet is at risk of exposure to ticks, we should be recommending a tick product that kills ticks rapidly, such as an isoxazoline. For dogs, in which tick-borne disease is more of a concern, we should be recommending a treatment that kills ticks within 24 hours before disease transmission occurs. The pet should be treated regularly at the recommended interval, depending on the product used. And with the increasingly mild temperature in the UK, ticks are able to feed throughout the year, and therefore year-round tick control may be needed. So next, let's consider roundworms. Roundworm eggs are widespread in the environment, and so any pet that has access to parks and gardens, or any pet that's free roaming, should be considered at risk of roundworm infection. As roundworm eggs can be passed to dogs and cats via infected small mammals, any pet that hunts and catches rodents or birds should also be considered at risk of roundworm infection. And roundworm can be transmitted to puppies and kittens during pregnancy and lactation from their mother, either via the milk in kittens or via the milk or the placenta in puppies. And therefore puppies and kittens should be considered to be at high risk of becoming infected with roundworm. And we also need to consider the family environment, as people can become infected with roundworm by accidentally eating roundworm eggs. So if the pet comes into contact with children, the elderly, or immunocompromised people, it's even more important to treat these pets for roundworm. So now that we know which groups of dogs and cats are at risk of becoming infected with roundworms, what treatment should we be recommending according to the SCAP worming guidelines? With puppies and kittens, which are at high risk of becoming infected with roundworms, it's important to start worming early, from 2 weeks of age in puppies and from 3 weeks of age in kittens. They should then be wormed every 2 weeks until weaning in kittens and until 2 weeks after weaning in puppies. And this is then followed by monthly worming until they're 6 months of age. Pregnant and lactating bitches or lactating queens should be treated regularly to control transmission to puppies and kittens. For adult dogs, the SCAP guidelines recommend that dogs are treated a minimum of 4 times a year. And for adult cats, indoor cats should be treated 1 to 2 times per year, and cats with outdoor access should be treated at least 4 times a year. However, if a pet is considered to be high risk, which is actually the majority of pets, then they require monthly worming, as this will kill roundworms before they start producing eggs, therefore reducing or even eliminating shedding of eggs into the environment. So let's now move on to tapeworms. So as fleas are the intermediate host for Dipylidium caninum, cats and dogs that aren't treated regularly with a flea product are at increased risk of becoming infected with this tapeworm. And especially cats, because their grooming habits mean that they're more likely to ingest fleas. Cats are more likely to become infected with Taenia tapeworm if they have outdoor access, if they hunt, and from a study we know that 72% of cats with outdoor access do hunt, and cats that eat a raw, unprocessed diet. Dogs are considered at risk of becoming infected with Taenia if they have regular access to sheep carcasses, they eat a raw, unprocessed diet, or they hunt. And if they live in an area that's endemic for Echinococcus granulosis, then they should also be considered at risk of this becoming infected with this tapeworm. And finally, travel abroad may increase the risk of a pet becoming infected with Echinococcus multilocularis. So if a pet is at risk of becoming infected with tapeworms, the treatment we use is praziquantel. But how often should it be given to the pet? Well, firstly, if the pet is treated regularly for fleas, this will eliminate the risk of becoming infected with Dipylidium caninum. But a pet will need treatment with praziquantel if they aren't on regular flea treatment and have developed a flea infestation. For Taenia tapeworms, cats that hunt or are fed a raw, unprocessed diet should be treated regularly with praziquantel, and this should be monthly if you want to reduce or minimise shedding. High-risk dogs with access to raw sheep carcasses or those that are on a raw, unprocessed diet should be treated once a month. And low-risk dogs should be treated every 3 to 6 months. For Echinococcus granulosis, dogs that are in areas that are endemic for Echinococcus granulosis with access to sheep carcasses should be treated once a month. And if owners are travelling abroad, don't forget to remind them that they'll need to treat their pet every month if they're visiting an area endemic for Echinococcus multilocularis. And depending on the country they're visiting, they are likely to need a tapeworm treatment before they re-enter the UK. And finally, let's look at lungworm. So location has previously been a risk factor when considering lungworm control. But now that we know that lungworm is spreading northwards and is now found throughout the UK and Ireland, treatment is increasingly justified in all locations. Dogs under the age of 18 months are significantly more likely to test positive for lungworm. Although it's important to remember that dogs of any age can develop lungworm infection. And dogs are also at risk if they come into contact with slugs and snails or their slime trails. So if a dog is at risk of lungworm, we should be recommending ongoing disease prevention with an appropriate product every month. So this is with either milbemycin oxime or moxidectin. Monthly treatment means that lungworms are killed before the larvae are shed in the faeces, i.e. within the pre-patent period, and this stops infestation progressing to disease. Dogs can be diagnosed with lungworm at any time of year, and so preventative treatment should be given year-round. So now let's consider what owners are looking for in a parasiticide. The number of parasites a product covers varies. Some are narrow spectrum, which are useful if you just want cover against a few parasites. But as you've seen, most pets are at risk of multiple parasites, in which case a broad spectrum product may be more suitable. If a pet does require cover against a wide range of parasites, and we're looking to make things as easy as possible for the owner, we know that 7 out of 10 owners prefer to use a single broad spectrum product, so I would bear this in mind when you're discussing parasite control with clients. Another factor to consider is whether to use an oral or a topical product. Now, there is a difference between dogs and cats, and obviously it depends on the individual, but generally cats are harder to tablet and are less likely to take an oral chew than dogs. And so topical treatment is often more suitable. For dogs, an oral product is usually easier, especially if it's a tasty chew. And actually 7 out of 10 dog owners said that they believe an oral product is more likely to deliver the correct dose. If using an oral product, it's also important to consider whether the parasiticide can be given with or without food, as this may make a difference to the owner. And it's also important to find out whether the pet will be handled immediately afterwards, or whether they'll be shampooed or go swimming shortly afterwards, as this will affect the decision as to whether to use an oral or a topical product. As not many cats get shampooed or go swimming, this is less of an issue for them. And what about the dosing interval? Well, the interval between treatments varies depending on the product. Some products are monthly and some are 12 weekly, so we need to consider which of these will best suit the client. Interestingly, it's been shown that 7 out of 10 owners found monthly dosing easier to remember than 12 weekly, and this may be because they're used to doing things monthly, such as paying their household bills. And as we discussed earlier, it's also important to remember that we need to worm monthly for certain parasite concerns, such as to prevent shedding of roundworm eggs and to prevent lungworm disease. So to summarise, each pet needs an individual parasite risk assessment to determine the parasite cover that they require and the frequency of treatment required. It's also important to consider what owners are looking for. Would a single or multiple products be more suitable? And would they prefer a topical or an oral product? And lastly, it's important to ask what dosing interval suits the client best. So I hope you've enjoyed today's webinar on control considerations. And if you'd like any further information about parasites, please visit the Boehringer Academy at www.boehringer-academy.co.uk.